for my friend in university and then like for my colleague. So today I'm gonna discuss for cytology, does it matter in clinical practitioner? So literally like the things that we have the issue right now, like every time that we have clients who come to us and then like, okay, let's say we have a bump and a lump. And then what is the next step? Because like, okay, let's say if you want to remove it and then wait from the pathologist, usually the pathologist in, as I know, in Indonesia and in Malaysia also, like it takes like 2 until 3 weeks in order to get the result. But
Recording in progress.
by at least by doing FNA, fine needle aspiration, it's just like non-invasive and then like it's cheap. You just sneak your needle and then like check under the microscope. You just put the stain and then you're gonna differentiate what's going on there. So let's discuss it right now. Wait, I'll put my spotlight. Okay. Okay. So from I need you to be active also. So if I have question and then I ask you to answer also, so please type your answer in the chat box. So from the four picture like this one, you can imagine for dermatitis, for the lymphoma, and then this is for the mast cell, and then this is for the squamous cell carcinoma, which is this is typically okay. Let's say this is typically like benign, like just like skin inflammation. But how about the lymphoma? How about the squamous cell carcinoma? And how about the mast cell? Everything looks similar. And then what is the next one? The easiest way to diagnose, to get something, what's going on there, you just need your syringe and then you just need your needles. Because and then like you need the microscope. After you get the sample, you put it on your object glass, you put the diff quick stain, and then you check it under the microscope. Why? Because you want to know what's going on there. Sometimes like the colleague asks me, doctor, how about like the needle? How about the needle, the size of the needle? Okay, so you can use it like between 16 to 23 G. Usually the one that I recommend is like 22 because 22 is the best one. You can get it any sample, especially like to differentiate, is it like inflammatory or if it's like typical like cancer. And then what is like fine needle aspiration? Some people would mention it fine needle aspiration biopsy. Some people would call it like fine needle aspiration biopsy, but it's literally like typical. It's same. We want to get the cells, so we call it like cytology. So the indication, if you don't know what's going on with the mass, and then you just nick your magic needle, you just like hold the mass and then like you take your needle and then like stick the needle to the mass and then just take it from different side. So what's the function of the fine needle aspiration? So just to make sure, is it like typically inflammation or the neoplasia? So for the neoplasia, so you can tell it, is it like typically epithelial, mesenchymal, or the round cell? This is the thing for you. I do believe like for mm, my junior who's still in the college, it's still like uh you still have the long way to differentiate for this one. But like let's say the basic thing. Okay, if it's like neoplasia, usually the things that you need to think about. Okay, Dr. Steven, I think like this is like more cancer. So I think like I'm gonna think about, is it like epithelial? Is it like mesenchymal or is it like the round cell? Epithelials, usually we call it like carcinoma. And then the mesenchymal, we call it sarcoma. And then the round cell, we are going to discuss it next. As you remember, for every part of our body, we have like the cells. Our tissue, it's like built by the cells. Sometimes the cell is overgrowth and then like the body just cannot compensate. If it's only like the benign one, usually you're gonna see it like a lump, warts, like something like that, or a mole. It's typically benign. But if it's like overgrowth and then they affect like the healthy tissue, so that's the thing that we need to consider. And then we need to find the solution for this one. And then like staging neoplasia, it helps. Let's say you want to take sample from the lymph node and then you stick your needle just to see what's going on there. Is there any spreadness from the mass that you suspect about? Like that one. And then the things that you have to remember for the fine needle aspiration is not a replacement test. You still have to go with the biopsy because the biopsy, you can imagine this is the cell, and then you just stick the needle. You just get only few cells. It's not like the whole part. And then like remember the terms like the bigger the better result. So we want the big, we want to get like the whole picture. The advantages, it's cheap, fast, simple, non-invasive one, and then like yeah, you can get like some answer. Okay, what's going on? Is it like inflammation? Is it like cancer? And then there is the disadvantages, like okay, the sample is too tiny. You cannot review what's going on there. Okay, let's say this is cancer. You don't know what's great that one, and then like how bad the innervation, because you can imagine even though like the mass is only like small on the surface of the skin, sometimes like the root is like big behind it. And then like how do we know? You should ask your pathologist because your pathologist will tell you what's going on there. So literally, this is the mass. You prepare the needle. You just like put like, let's say this is my finger. It's like the needle, and then you just sneak it like this one, and then just like do like this to around the lump area. So at least you will get everything from it. It's same also like this one. Literally, if you want to use the syringe, it's good also. So this is the mass. If it's like only like raised a little bit, so you stick the needle, it's same. You just do all direction because we want to get like good and enough sample. And then after that, you take off the syringe and then you fill it with the air and then you spray it to your object glass. After that, you can just do like impression like this one. Don't push it a lot. Don't push too strong because like it will make like the cell lyse easily. So just like slowly and gentle. Sometimes I love to use like okay, this is the needle and then they have like the cover. So I use like the cover of the needle and then like, I just like make it like spread to my object glass. So at least I'm gonna know like what's going on, what cell is there. So the biopsy and the histopathologies. So biopsy, the indication like it's more accurate, definite diagnose for all tumor, and then like give you answer what's going on with the cytology. The advantages like okay, the sample is big, you can access all the tissue. It's more you're gonna get like definite diagnose, and then you can ask your pathologist to get grading. Remember, bigger is always better, but there is disadvantages also. So it's more invasive because you need to sedate the animals, you need to put the stitches, takes time for the healing, and then like yeah, usually like if you do only FNA, there is no like healing period. But like for the biopsy, you have to wait until the wound heals, like that one. There is also any possibility that you would not get any diagnosis if you do not get like proper sample. This is the thing that you need to make sure you're gonna get like good sample, like that one. Okay, this is like the sample of the TCC, transitional cell carcinoma from the bladder. And then at the biopsy and the histopathology, a lot of technique that you can use. Usually you can use like the excisional and then the incisional. Excisional, it means like you just like remove it and then like you make like the excision. And then the incision, okay, you can use either like the punch biopsy, the wedge biopsy, needle core, and then the bone marrow biopsy. Let's discuss it a little bit. The needle core biopsy, it's literally like you use the things like here, the kit, and then you just sneak the needle to the lump, you push it, you press the button, and then like they will close it, and then they will trap the tissue in here. So usually this technique, you're gonna take like, let's say, I wanna get like good sample from the liver, from the lymph node, from the lung, and then like, okay, let's say this needle core biopsy is very useful for the biopsy for, let's say like for the round cell, typically like round tumor, which is like, you can feel it, not like flat one. And then like for the needle core, better you take it like 3 to 5 sample in the area of the tumor. And then the punch one, the punch usually like it's for the superficial lesion because you will literally like to clip the hair and then like you wanna see, okay, this is the lesion that I want to take. I just like use, it's literally like you punch with something, like press it and then you take it. So literally you put it on the position of the mass and then you press it, you're gonna get something because like it's typically like the blade is circular one. And then like the celerity for cytology, the things that you need to evaluate, is there any like the intact cells with minimum of the blood contamination and then like it's spread in the good monolayer area because like you wanna know what cell is it and then like you wanna know, is it like the cell is intact or not? Let's see. This is like the nice one. Okay, let's say this is the FNA that you get, you wanna see, you're gonna expect like something like this one. And then this is the things that you're gonna hate because this is the cell, this is the round cell, this is the this is the nucleus, and then like you don't see any cytoplasma because why? Because you squash it like too strong. So you don't need like to squash it too strong because like the cell, you need to like uh take a good care of your sample unless like you're gonna see like something like this one. This is like typically lice cells. And then like how do we differentiate between the inflammation and the non-inflammation? For every lump, for every mass, you have to think it first. Is it like inflammation or non-inflammation? If it's like the inflammation, okay, let's say, is it like suppurative, eosinophilic, granulomatous, lymphocytic, or the mixed one? Okay, let's say it's suppurative, so it means like mostly you're gonna love to see it will be like neutrophil, a lot of neutrophil. But how about like if it's like granulomatous? The granulomatous, like usually like you're gonna love to see like macrophage. There is still like neutrophil, but like it will be like more macrophage there. And as if it's like mixed pyogranulomatous, it means like you're gonna see like 70% like it's neutrophil, but like the rest, like you're gonna see like some few of the macrophage. Lymphocytic, it means like you have to find the lymphocyte, and then the eosinophilic, that you have to find the eosinophil from your cytology. So as you can see it here, you're gonna see like, okay, this is the neutrophil, and then this is like the with the cytoplasma, like with the granules, the red one. So this is like eosinophil. So you can see, okay, the eosinophil like it's increased, and then you can imagine from the one few like this one, you will know like, okay, the eosinophil is a lot. What's going on there? Is there any allergic? Is there any like bee stung or something like that one? And for this one, you can see this is like all with the neutrophil. You don't see any like, I don't see any like macrophages. It's more to the like neutrophil. So I can call this one like suppurative or purulent. And then like the right one below here, it's more to the lymphocyte. So I'm gonna call this like lymphocytic inflammation, like that one. So if you can see it here, the things for every cytology, okay, let's say you have to see the bigger picture. Sometimes like you're gonna see like, Dr. Stephen, what's going on the right upper here? What's going on here? What is this one? I don't know about this one. You don't need to know every single details. The things that you have to know, it's like you see the big picture of your cytology. What's going on there? Okay, from this one, I'm gonna say there is like inflammation there because I can say there is like inflammation. What is this, doc? This is the big one. but like mostly still like the inflammation. Okay, so we know it's still inflammation. So the big one, it's supposed to be the macrophages, because the macrophage, like usually like they can be like big